Recent research findings demonstrate that prolonged sitting at work raises the risk of dying from cardiac and metabolic diseases, as well as the risk of dying from all causes, even if you work out or exercise. There's some good news though. Other studies have established that regular physical activity can improve your health by helping to control weight, maintaining healthy bones, muscles, and joints, reducing the risk of developing high blood pressure and diabetes, promoting psychological well-being, and reducing the risk of death from heart disease. In addition to these health benefits, researchers are also learning that physical activity can also help reduce the risk of cancer. Cancer.gov reports that there is convincing evidence that physical activity is associated with a reduced risk of cancers of the colon and breast. The specialists at Florida Hospital Waterman Cancer Institute explain how the primary risk factor for developing cancer is time.
The primary risk factor for almost any cancer actually is age. So cancer is a disease primarily of the elderly. That's something we often lose sight of. So as we get better at taking care of other chronic diseases like lung disease, heart disease, diabetes, we see more and more patients living longer. And as a result, cancer becomes a more and more prominent factor in a lot of patients' lives. So that's a challenge that we deal with, an aging population, more diagnoses of cancer, and to some extent tailoring our cancer therapies towards more older or more elderly people whom may not traditionally have been thought to be candidates for full dose chemotherapy or radiation therapy. So we're constantly balancing those two factors.
I don't know why we're seeing an increased incidence of cancer other than some fairly commonly accepted reasons. One is that we're living longer. And cancer is a disease of people as they get older, much more common as you age. And so because we're controlling heart disease better and we're not dying from infectious disease like we did decades ago, cancer has had a chance to show up later in life.
As you age, the thought is you can tolerate less anti-cancer therapy, which historically has been considered relatively toxic, particularly certain types of radiation therapy or chemotherapy or surgery. Today's 80-year-old is probably different than the 80-year-old from 20, 30 years ago, in that they're much more active, robust. Certainly here in Lake County, our elderly population is very active. And you start to think, well, just because this person's age on paper looks quite high, can they really handle or can they not handle the therapy which we might give to a 60-year-old with the same diagnosis? And more often we find that with judicious selection of therapies and aggressive supportive care, we're able to get those patients through the same type of anti-cancer therapy that we could offer someone younger, and thereby offer them the greatest chance of being cured.
You'll find more information about the link between cancer and exercise, as well as contact information for Florida Hospital Waterman's Cancer Institute when you click on the Cancer Risks Story Link icon on our homepage, yourhometownhealth.com.